Hello again. Welcome again to your local and global health module, and it's lovely to see you all. I'm so sorry I haven't been able to get the chance to be able to meet you again in the classroom, but it's lovely to virtually see you all again. So today's lecture is about health and sustainable development, and what I want to try and talk to you about is how places like the World Health Organization offer ways of managing health and assessing and evaluating health across the whole world. And in many ways, like we did with the pandemic many years ago, it's about trying to understand how we all pull together to make sure that we live healthier lives as global communities. So I'm going to talk to you today about something called the Sustainable Development Goals, which is developed by the World Health Organization. And the reason why they've developed these goals is just to make sure that we have one overarching company, the World Health Organization, to be able to coordinate and plan and manage health status on a worldwide scale. We each individually do our own things through health policies and government policies and local and government and national policies, but sometimes we just also need to pull together, to pool research funding, to pool any sort of responses to pandemics or epidemics or however we do. So this is what this series is about today. So hope you find it useful and enjoy the lecture. So basically what I'm going to try and do today is just to get you to think about sustainable development goals, and I'll go into those in a little bit more detail, but please do access lots of the resources that are available within your Moodle site for this unit. What you'll find is I've used the Sustainable Development Goals in my time to support some money for research and for some funding. It's been really cool. It just sort of gives you access to funding to be able to research some of the most vulnerable people in our society, and that is so important. But Sustainable Development Goals offer a way to be able to structure what we're doing. So today I'm going to talk to you about those Sustainable Development Goals, and I'm going to get you to start thinking about, where are we challenged in the next century? How are we going to deliver healthcare in the future? Now, I started my nursing in 1988, I'm showing my age, many years ago. And then nursing was a very different career. It's a different, we had different opportunities and different roles and regulations. Nowadays, many of the patients that I would have seen in intensive care are dealt with in acute care, or many of the cases that I saw in hospitals and wards are now dealt with out in the communities. And that's okay, that's the UK healthcare system and that framework. I've lived and worked in Australia and Saudi Arabia, a couple of other countries as well where I've worked, like China and across in India and a number of other countries. And what you find is there's differences for every single healthcare system that you do. And that's because you have to have different priorities. And those different priorities are there just to see, to make sure that we deliver the healthcare for our own populations. So a population in the middle of very rural India, for example, will have very different health needs to a population in central London, for example. So it's really important that we look at those, we look at what healthcare requirements we have per population and make sure that we can deliver healthcare in those, appropriate to those populations. Now, what you'll see as nurses in your own areas now, and you're all currently running around Manchester Foundation Trusts and lots of different Manchester hospitals. That's great. But as your career progresses, as you start to move forwards and as you start to move on and you start to get into research, you start to realise that we need a workforce, a healthcare workforce, which can meet global challenges of healthcare. We're not just limited to Manchester, we're limited to the world. Before we start to think about any of the goals and everything that's going on with regards to all of our patients, I guess one of the first things that we need to do is start thinking about what health is. We all say that we want our patients to be healthy, but health is different things to different people. Now, Dalgren and Whitehead organised health as a bit of a framework, as a bit of a theoretical framework, which identified health as a social determinant. If we think of ourselves as being healthy, it doesn't necessarily mean we are free of disease, which is the World Health Organization sort of original thoughts of health. We need to start thinking about what actually makes us feel healthy. So, for example, we need to make sure that our lifestyles are enabling us to feel healthy, that we can get out and walk every day, or we can exercise the way that we want to. We have access to food and drink. The other determinant as well of health is the fact that we have communities. We've got all of our friends and relatives all around us, and that keeps us happy, healthy. It looks after our mental health as well as our physical health and well-being. But you can see here what Dalgren and Whitehead model has identified is that health has to be considered in so many different contexts. When we discharge our patients from wards, this really matters, because when we're discharging our patients from wards, be that mental health wards or paediatric wards or whichever wards you're on, you have to think about what you're sending patients home to. I was a midwife for many years, and part of that role, and an advanced neonatal nurse practitioner as well, so part of that role was discharging our babies, our very, very vulnerable, tiny little premature babies, into community settings. And what that meant was we needed to make sure that the community settings were relevant and okay to have the babies go back to return to with their parents. And we all want to be at home, whether that's to be at home for a process of dying or whether that's to be at home for a process of living well with a condition or an illness, or whether that's a process of improving, recuperating and becoming what we would consider healthy again. So what we have to do is really unpick, what do you think and what do you mean by health, and how does that work effectively for you? So I want you to have a think, give yourself 5 minutes and just have a think about what health means to you. How are you the healthiest? How are you positioned physically, psychologically, emotionally, financially, the whole gamut? How do you feel the most healthy, the most satisfied with life, the happiest with your life? And add that to this Dalgren and Whitehead model. Now, when it comes time to you doing your local and global health assignment, you're going to be asked to consider health in the context of whatever thing you choose to do your PowerPoint on. Bring in that Dalgren and Whitehead model. Start thinking about what this means to actually actual patients, and what that means to different comorbidities and different social conditions, health conditions and psychological conditions. One of the reasons why we bring Dalgren and Whitehead in is because he developed, Marmot Review, the government actually did this whole review of the UK healthcare system and identified that there's a lot of stuff that we need to be doing. Our health is determined in some ways by postcode, which is really, really alarming. In this day and age, you'd think in 2014, 2024, 2034, 2044, that we would be improving with our health and well-being. It's not necessarily so. There are significant disparities between postcodes, there are significant social inequalities across different populations and different subgroups of populations. Certain ethnic minorities have far worse outcomes than others. And this really, really matters. So Marmot, when he looked at a big review and a strategic review of our health systems across the UK and the health inequalities that occur across the UK, identified Greater Manchester as being quite severe in terms of health outcomes. So what can we do to improve them? And the first step is perhaps to measure them. And we can use things like the Dalgren and Whitehead model to look at all the factors and evaluate all the factors, and that's how we use it. That's why it's a model which is really effective. And it's all very well and good looking at Manchester and the fact that we've got significant proportions of communities who don't actually have access to care in the same way, or they have access to care which is hindered by certain physical or emotional or mental health difficulties because they're from certain ethnic minority communities. Translations are inadequate. Services don't necessarily adapt to certain cultural norms and requirements. That's fine, it's very, very UK focused. But let's just take a step back, because as nurses, we have to be global citizens. We have to be global healthcare developers, deliverers. So England is a country in the United Nations, and part of the United Nations Pact or treaty or agenda is to make sure that we all sign up for certain basic standards of care, managing, looking after our communities and our citizens across the United Nations and across the globe. These goals are about improving health, improving education standards, growing an economy which is going to be open and honest and transparent and available to all. And it's about reducing those inequalities that we have identified. And you can see here, so these Sustainable Development Goals offer a shared blueprint for peace and prosperity, and that's for everybody across the planet. It's not just people in the UN countries, it's people across the world as well. And what we're trying to do with these UN goals, which is working with the World Health Organization and the United Nations, is to see what sort of strategies we can do, how countries can pull together to improve poverty, to help to reduce inequality, and also to tackle climate change as well, which is quite a significant requirement nowadays. So in 2015, all the United Nations states made this big pact, and they all decided to have all of these wonderful goals. And it's, you know, there's some great ideas. So we're wanting to strive for peace and prosperity for the whole planet, not just for certain richer countries. What we're trying to do is to look at how we can develop and sustain our own world for a better future. So the United Nations, they all got together, developed these 17 goals, and you can see here they're all about trying to develop this nice future, sustainable future for our kids basically and the grandchildren. They were set up in 2015, and in 2015 everybody got together, all the member states got together and decided, right, by 2030 we're going to have no poverty, zero hunger. We're going to work in partnerships. We're going to develop some really good institutions. We're going to look at life on land and managing to live with water. We're going to tackle climate control, tackle climate issues. We're going to offer clean water to everybody. So there's a number, you can see there, from 1 to 17, there's a number of these goals that are absolutely, I mean, they're beautifully written. They just offer this lovely framework, and it means that we're all going to be working in a global partnership, really. Basically, it's all about realising human rights, achieving gender equality through human rights as well, empowering women and girls, eradicating poverty in all its forms, ending world hunger. So it's, you know, it's this big eclectic mix of where do we want to be as a civilised humanity, I guess. And this just offers this lovely framework, I guess, because if you don't have a framework and you don't have goals that you're working to, are they really going to be effective? You know, is anybody highlighting what it is? How do we prioritise where we head next? How do we measure what we're doing and how effective that is to try? And all the member states got together and said, right, this is how we would love to see the world in the future. So in 2015, these were developed from these member states. So basically the way that we can, this Sustainable Development Goals offers a framework, and it's all about world peace, poverty, managing all the other sort of healthcare and environmental factors, how we all work together to form a better future for all. But what we can do with that Sustainable Development Goal, as you can with any framework, is chop them into a couple of little manageable pieces. Each one of the Sustainable Development Goals will have some little piece that you can concentrate on or focus on. The first 7 are an extension of those Millennial Development Goals, which was the big, eclectic, end hunger, end poverty, world peace, make sure that we don't have any gender disparity or any disparities across communities, the whole lot. And what you find is that those first 7 are, the big overarching eclectic things, no poverty, 0 hunger, good health and well-being, education for all, gender equality, good water, sanitation, and affordable and clean energy. And this was all by 2030, this is all sort of identified. The next 7 is all about how we can pull things together, how we can work most effectively together to start to look at things. Now, those next 7 goals focus on things like sustainability, decent work, economic growth, how we can get industry to innovate, which will lesser impact the environment, how we can reduce inequality to access to services, to transport, to heating, lighting, whatever we need, how we can develop more sustainable cities and communities across the environment, and how we can look at the consumption and production of food or any materials in a more sustainable and responsible mechanism or way. It brings in the climate action and the climate change and the net zero agenda that we have. And it also talks about how we can actually manage to live. We all know that with global warming, that there's potential that that there are areas which are flooding. There are big problems with managing and living with the potential flooding and living with water. So what we have done there with that Sustainable Development Goal is look to see how we can live most effectively with the potential areas where there are floods, how we can live more readily with water. The last 3 are about inclusivity, how we can develop jobs, how we can industrialise and distribute services and resources most effectively for the good of the environment and for the good of the people. And this is about how we manage life on land, how we can look at peace and justice and develop strong institutions with respect for all, and how we can really, really establish great partnerships for the good of all. So this slide just basically encompasses all of those 17 social development goals that I've been talking about. And it would be a really good idea for you now just to take 5 minutes time out and to think about what this means to you in a nursing context. So for example, let's think about good health and well-being. You've all had lots of clinical experiences now. It's fantastic to see that you've all been out there and you've all experienced both hospital and community setting placements. But let's try and think about how you, as a nurse, as a healthcare provider, and as somebody who's promoting health and well-being in the communities, not just for your patients, but for all of the family and everything else as well. How can you help people better manage their life and their lifestyles? So let's look at good health and well-being, for example. It's not just you in the communities when you've been working with the GP surgeries. You know, when you sit in those community settings, when you go to those patients' houses and you sit in their houses, it's not just you that's offering assistance. They might not even want you there. So how can you help them better, and how can you liaise with them? And this is something that we talked about with the communication in the resilience and relationships module that you're doing at the moment. This is how to work with people so that they can be empowered, so they understand and they can access the services that they need to be able to access what's best for them and how and services that can best support them. So for example, you might be thinking about good health and well-being. What's to stop us from linking in with the NHS, the public sector, the voluntary sector? What's to stop us from linking into many of the services that are available? Walking for Health, for example, social prescribing initiatives, working with social services, and private and local industries, food banks, to make sure that people have an idea that these places exist in the communities. We don't want to be sitting here as, as nice middle class university lecturers who will say this is what's best for you. What we need to be doing is sitting with them, with the patients, to understand what they need, what perceived needs they have, how we can most effectively support their own choices in how they want to manage their own health. So Sustainable Development Goals, yes, it's this eclectic idea about the UN nations, but it actually matters to us. It actually matters to us as nurses, because what that means is that we could access research funds that might be able to help us to develop a new service. We can actually access different private and public sector industries and institutions that can actually develop some of the things as adjunct to what we're offering as well. But the only way we're going to do that is if we all work together and we know what's out there. So this slide really is just one of those sustainable development goals, and this is about health and well-being. Now, if you're a researcher like I am, and you want to access money for funding, for research on these sorts of things, these Sustainable Development Goals are fantastic because they give you a hook to hang your research project on, for example. So I'm going to try and hit a Sustainable Development Goal, for example, to reduce the global mortality, maternal mortality rate. Now we know that the mortality ratio is significantly higher in certain countries. So we can use that and say, right, I'm going to target that country because that's the one with one of the worst mortality rates, for example. And it really helps us just to sort of identify what's going on. The World Health Organization hold a load of statistics that you can pull forwards to be able to identify that there is an issue, and then you can use a Sustainable Development Goal to say, look, UN nations are saying that this is what we've got to do, so this is what my research is going to do. Overall, all of these things that you can see here from 3.1, 3.2 all the way to 3D is, it should be a given. It should just be what we do anyway. But that's not the way the world works. The world works by having to step back, having to look. If we're informing policies, we need to identify what the problems are before we can start to look at policy-driven measures to be able to affect a change. So, for example, we're trying to reduce maternal mortality. And this is significant. It might not be massive in the UK, but it certainly is across other countries, and that's really, really important to acknowledge. This idea about 3.3, end epidemics, combat hepatitis, waterborne and communicable diseases. You need to remember this was developed in 2015, these Sustainable Development Goals. COVID hit. And when COVID hit, childhood immunisation was completely trashed. So was illnesses and deaths, they spiked. Healthcare disruptions reversed decades of all of the little sort of measures that we put into for improving access times, wait times, access to healthcare. It's really important. We can't end epidemics. We can't end pandemics. It's going to happen in the future. There are going to be things that happen. But what we can do is enhance our preparedness to be able, I can't say that word, our preparation measures. We can understand how we can react and interact with a pandemic to make our containment measures so much more effective. Air, water, soil pollution, fantastic. But how do we know it's there? How do we know we can end it before we know it's there? So it's about just taking a step back, looking at these Sustainable Development Goals as a framework, much like the Dahlgren and Whitehead model that gives you a framework to what health and well-being is, to make you think about what aspects of a person's being is affected on health and well-being. We now look at Sustainable Development Goals to look at what things we need to concentrate on or focus on for health and well-being. So on this slide, I'd like you just to take some time out, just to right click on this TED Talk by Michael Green, and I want you to have a look at what he has to say about how we can make the world a better place. It's a fantastic one, but he also talks about that. How do we achieve those sustainable development goals? And here's where normally, if I was sitting in a classroom or standing in front of you, I will be playing this next slide as well to you. So do please access these YouTube slides and sites. They are really essential because they raise some really great ideas and some considerations that you may choose to use in your assignment for this local and global health, for critical analysis. It's really, really important. This one in particular raises some really interesting considerations. So here's a note on equality and equity. We talk about everybody having access to services. Fantastic, no problems at all. We talk about these new GP systems where everybody's going to be digitalised and everybody can access GPs easily through use of information technology and mobile phones and smartphones and everything. That's not really equal. It's not really equitable. We have many elderly patients who, for example, aren't IT savvy, who can't navigate the patient systems to be able to get access to a GP surgery, who can't use online apps to be able to get their next prescription. They prefer face-to-face. Some of our elderly have, the only face-to-face interactions that they have is when they go to the shops. Now they're just faced with automated systems to be able to do their own shopping through an automated till thing. That's offering equality for all. It's offering services which are equal for absolutely everybody to be able to access GP surgeries or access getting their groceries once a week or however long. But it's not fair on certain people, and it's not until you start listening to people and start saying, is this okay for you? Does this work for you? And here's where I just raise this when we're talking about equality or equity. And I raise this, I want you always to think about your patients first and think, all right, we've made this decision to switch our services to digital, or we've made this decision to have mixed gender wards. How does that work for the poor girl who might be in after having been subject to gender-based violence or abuse? Or how does that affect the young lad when he's going through adolescence and he's sitting next to women? What do they want? How do they feel about things? And should we be offering alternatives? The NHS is a utilitarian system. We have to have the greatest good for the greatest number. That's what utilitarian means. We would love to work on beneficence, which is good for all, equity for everybody. We can't. We have limited funding, limited resources, limited everything. But what we're trying to do as nurses, and as nurses who do sit on that sort of framework, we are trying to offer equitable access for everybody. We're just trying to make the best of what we've got right now. Now, equality means giving everybody exactly the same, whereas equity means giving some people not as much because they don't need it, and other people more because they do need it. And that's the basis of equality versus equity. So equity means that every single individual or group of people are given the same resources. Equity recognises that each person has different circumstances, and therefore equity means that we can allocate the exact resources and the exact opportunities that those people need to be able to achieve the optimum outcome. So moving away from just the challenges that we have in Greater Manchester, across to the changes that we have in the UK system, let's look worldwide. Our problem right now is we're facing a world that's warming. So we're seeing a lot of vector-borne diseases, dengue fever, for example, malaria, issues there that are caused by So many problems that are associated with the dampness that seems to be happening with global warming at the moment. In the Northern Hemisphere, we've seen heat waves and problems with wildfires in Australia and across a lot of the countries that are slightly warmer. We've seen the Asia Pacific being really terribly affected by floods. And of course, these things don't just come alone. They come with significant diseases. And if you're elderly or disabled, or your health and well-being has been affected by other things, it's just going to exacerbate everything that's going on. We've got gravely serious problems across Sudan. We've got Brazil and issues there with Brazil and the fact that they've got some Zika virus, for example. Tuberculosis is on the increase as well. We all see all of the migrants in many of the UN countries at the moment, and this mass influx of migrants means now we need to start thinking about HPV vaccinations and managing the tuberculosis and managing the conditions and illnesses and differing healthcare requirements that come with a changing dynamic in population. So as an epidemiologist myself, so my PhD was in health geography and I used a lot of epidemiology to help with my research statistics. One thing that I notice is this changing dynamic of population. UK, for example, we're an ageing race. China is heading towards this population pyramid where most of their population are going to be aged, with very, very few young population to care for them and to deliver healthcare to them. How do we tackle this? And the problem is that we can see there's big political instability at the moment across in Palestine and Egypt, and wars around. These all bring a political instability which is really worrying for our patients. I mean, I've focused a fair bit here on health and well-being, but what does it do for the mental health status of our patients? These are worrying times, and we need to find out how we can possibly bring back the heart. And Sustainable Development Goals help us to do that, and also thinking back and just being that big group of nurses, how we can make things better. How do we tackle climate change? How do we redistribute our own workforce to make sure that we can offer equitable services for all? How do we manage that in a time when we're all under this global recession? Resources are limited, at a time when the rich are getting richer, but the poor seem to be getting more and more poor and have different needs. What can we do? What can we do as nurses to make things right? Now, we're very lucky because we've got toolkits to be able to help us. And here's where my penultimate slide here, I'm just going to introduce you to some of the things that you could do. Have a look on the Health Foundations toolkit and the hyperlink in this document here. It might help you with your poster that you're going to be developing for this particular unit. Just a little hint there. You can use those social development goals that I've just identified to help you to look at potential research funding applications, or to help you to drive public policy. Now, as you start in your nursing career, you start and you're working on wards, or you're working in the community and you have your very, very small group of patients, or very large group of patients, unfortunately, and you've got them there and you're looking after their mental health or their physical health or both. As you develop through your career, and this is something that's happened to me, you develop through your career and you end up helicoptering up. And this helicopter means that you then become ward sister, manager. You then become a researcher or a clinical nurse specialist, and you start to develop. And what it means is you start to see not just the ward, but you start to have to plan and resource, and you have to start thinking, what's the population that I'm serving needing? So you start thinking about what the population on your ward is, for example, and then you move on. What's the population in the area? What's the population in the Greater Manchester Integrated Care Board area? What happens to the UK? What happens in the world? And it starts like that. And that's when like for myself as an influencer, as a researcher, I was reading Influencing Policy. As a researcher, I've got to think, what can I do? What's coming next in the world? Now, I remember in 1995 saying to people, the next threat's not going to be a war, it's going to be a virus, because you can just see all the aeroplanes going around and the populations becoming more and more intertwined, and I guess the global outlook of people has changed so much in my own lifetime. You know, it's no longer too expensive to travel across the world. We can do that in very easily. What that means is viruses will spread quicker. Everything will just be impacted by how we live our lives. So when I'm writing a research proposals, I'm thinking about government policy. I'm thinking about populations and what we need for health of our populations and how best to serve our populations, how we can measure them and how we can evaluate effectively where we're going to be in 10 years' time. I don't think anybody could have predicted what happened during the pandemic and the lockdown. If you think back to yourself pre-lockdown, would you ever have imagined all of the things that went on during that period of time? And this is where you as nurses need to be thinking, because you're the future of our nursing profession. I'm heading off to my retirement, I'm assuming in the next, good few years, but in the next link of my own development. But what I am seeing is this population pyramid, this aging population, this need to manage the increasing comorbidities that are associated with the fact that our health status, as we treat more diabetic patients and cardiovascular problems and diabetes and all of these other things, later on we are going to have different requirements for those people because they're going to get age. Now, the more improvements that you make across health services, the more impact that has on how they manage healthy aging and healthy status during the later stages of their lives. We are no longer at a stage like we were in the beginning of the century when people would die at 50, 60 of old age. We're now living longer and we're living more complex lives with more complex comorbidities and significant treatment requirements as well. And that brings different focuses for you as nurses. And what that means also is that we need you, we need your voice to be able to support and stick up for people who haven't maybe got a voice, for those communities that are either black and ethnic minority communities, for example, who struggle with certain services, maternity services, mental health services. Our prisons have very, very disparate groups of individuals. Why? What does that mean, and how does it impact health? So I want you to start thinking about those things. I want you just to start thinking about, right, even from your own perspective, this is me, this is what I need. How does that make me different to my neighbour? And if that makes me different to my neighbour, how would they struggle to access care, attention, the stuff that they need? And how can I make that better for them? As nurses, we have a duty of care. We are the voice of our profession. We have to demand equity in service provisions for everybody. But we also have to demand an equity in managing workloads. We're not supposed to be standing saying, oh yeah, nurses need to be more resilient. Maybe nurses just need to start standing up for ourselves and saying, actually, we need a work environment that's going to help us to work better. We need standards, we need structures, we need resources that are going to be able to help us work better and more effectively for our patients. And there's only one person that can ask, and that's you guys as nurses. You need to be asking and demanding those things. And the reason why we're demanding these things is for our patients and their families. It's for our communities to make sure that we do uphold those sustainable development goals and develop a better health for all. So I'm going to finish this whole lecture off. There's plenty of references and everything within the whole Moodle site, and that's all embedded within the Moodle site. But the most important thing is try and access this. Act now. This United Nations Toolkit offers you a multitude of resources that you can actually access to be able to help you to have some impact for the future. What type of nurse do you want to be? And if it's somebody that's going to make a difference to people in the future, then act now. I hope you've enjoyed the show.